This program, it's called the BHOAP, helped me through some very threatening times in my life. This is like a life raft that's providing a rescue for people like me that are desperately seeking the help that they need to avoid ending up on the street, to avoid ending up in the prison. This is a rescue operation. It gives me hope. It gives me encouragement. It lifts me up. It gives me a reason to be alive.
As we age, we gain protective factors like wisdom and resilience. Counter to what people might think, depression's not a normal part of aging, and we have the potential to thrive in our older years. Yet, older adults face many barriers to mental health treatment. That might include the cost of copays, lack of transportation, social isolation, perhaps a co-occurring cognitive condition that can affect people's ability to make appointments, and high rates of stigma around mental health. So they're the least likely of any age group to receive treatment.
There's still that stigma, and that was one of the first thoughts that ran through my head, and I thought, do I want people to know I had anxiety? I spoke to one of the supervisors here, and he suggested that I file a protective order on myself because I was facing being homeless, and I did that. He said, would you be interested in getting some counseling? And I said, yeah. And so he put in the referral, and that's how I got connected to the BHOAP program and to Nikki. And she's a great listener. And yeah, I feel supported in that, heard, and yeah, it's just been really a lifesaver in the situation I'm in.
We knew we needed more services and supports for older adults that had mental health challenges.
I'm on the BHOAP team. BHOAP stands for Behavioral Health Outreach for Aging Populations. It's a team of social workers, therapists, mental health counselors, and we work with older adults, whether it's interpersonal conflict or food insecurity or housing instability. We're either invited into their homes, which is a really unique aspect, to kind of interact with people in their natural environment, or they can come to our offices and we can kind of have that more traditional psychotherapy, like you sit in a chair, I sit in a chair, and we talk, processing together and coming up with goals.
As I got older, I learned more and more about depression. And it turns out I have bipolar disorder, which is not something I ever wanted to even think about or talk about, but when it knocks you down, you gotta deal with it. We feel like how we feel right now, horrible, horrible. Nobody loves us. We feel very, just distressed. And you think that that is who you are. And of course, that is not true. With people understanding and being more accepting of who you are and what you're going through, but look at me now. I am probably the happiest, healthiest person I have ever been now in my life. I really am. It's just, I can't believe it, I really can't believe it.
In American society, older adults, because they are not, they're undervalued, they're not looked upon as productive anymore. I think America is a big proponent of productivity, making money, and when you're in stages of your life where you're not able to do that maybe as well as a 35-year-old, a 45-year-old, you're kind of tossed to the wayside and kind of, figure it out.
It's extremely difficult because depression is like an enormous that surrounds you and paralyzes you. And not only you can't move, but you can't even breathe sometimes. They help me to feel alive. They make me feel like a human being, that I'm worth something. It's really the only people I talk to, the only people I come in contact with.
Working with older adults, you really get more than you give. Clinicians talk about vicarious trauma as a hazard of working in the field. I think with older adults, there's vicarious wisdom. When I started out, I was young, and I think a lot of people who are young are hesitant to go into the field, but I learned so much from the people I work with. I grew spiritually, I learned about history, about life, and working with older adults has truly been one of the biggest honors of my life.
The road is long with many a winding turn that leads us to who knows where, who knows when. But I'm strong, strong enough to care for him with the sadness that everyone's heart isn't filled with the gladness of love. He ain't heavy, he's my brother. Woo!
Very soulful. Very soulful.
Yeah, that says it all. Everything I wanted to say, just in that song.